Hello, everybody. Thanks you for joining me in today's webinar. Today's topic is MPS and depression. I find this topic really useful, but I need to admit that I had a lot of troubles to find some research on this topic. Unfortunately, there aren't enough research for mental health and MPS, or how MPS, or if it's really connected with some mental disorders. What I have found is that there are a couple research for MPS 3 and aggressive behavior, but for other MPS types, there are no any research. And that's why I decided, you please mute yourself. Thank you. So what I wanted to say is that there are a couple papers that are showing that MPS influence to aggressive behavior or to sleep disturbance, or there are some MPS 3 patients who have difficulties with nutrition or with biting. But unfortunately, I couldn't find some interesting papers on how MPS is, or if it's connected with mental health. So I decided that I will need to focus that MPS, as any other chronic condition, can be, and it is connected with depression, anxiety, and other mental disorders. Unfortunately, we don't have any knowledge of if biological and hormonal changes in MPS patients can influence to developing depression. So that's why we have a lot of patients who suffer from depression, but we don't know if it's because of biological connection or it's just respond to really intense situation, life situation. And that's why I wouldn't like to say that depression is connected with MPS, but also I wouldn't like to deny that because we don't have any findings. So I will just speak about depression and MPS patients without having reason why depression is showing up. So when we speak about chronic diseases and patients who suffer from it, 3 times are higher chances for you to get depressed. And it's because life situation is pretty challenging. Because when you have chronic condition, especially MPS, it affects your ability to walk. You have poor endurance, mobility, and it's often associated with pain. So this negatively affects to your quality of life and activities of daily living. Because of all those symptoms of your disease, you have experience that you need to be dependent from family and friends, and also it influences your participation in school or work or social life. And then when we have this kind of isolation, then we start to question ourselves, our self-esteem, our activities, and we try to isolate ourselves. So that's why when we speak about some chronic condition that affects a lot of daily activities, even here we can realize that somehow chronic disease makes you isolated because you cannot do regular daily activities, or you can do but you need extra support than people who don't suffer from any chronic condition. And when you have impaired vision or hearing or frequent surgeries, that also affects to some reducing of physical activities. And it's also hard to have independency or to be employed, or even ability to be to just be focused on yourself. Like usually you need a lot more support than other people. And as I said, in some cases, depression appears to result from some specific biological effects of chronic medical illness. And there is no finding for MPS, how it affects the depression. In other cases, depression and chronic illness are connected by behavioral mechanisms. So the limitation of activity because of chronic disease leads to withdrawal from social life and another activities that people usually enjoy. MPS patients are in a higher risk because of chronic condition, and those risk factors include couple reasons. For example, risk is higher when you have personal or family history of depression, when you have some life changes, trauma or stress, when you have certain physical illness, or when you have difficulties to cope with daily activities. In terms of psychotherapy, when we speak about depression, it is creative adaptation to situation, emotions, and feelings that overwhelmed us. When you look from medical point of view, depression is a condition that you need to get treatment for that, and usually we speak about antidepressants. But if we speak from psychotherapeutical view, that's certain way of creation that helps us deal with situations or changes in our life that can be demanding. So because I'm a psychotherapist, I will speak from this point of view, where depression is creation on life situation and circumstances that at some moment are bigger than us. And I will start from defining what depression is. Depression is a mood or a state where it's hard to be involved in daily life. It's hard to get enjoyment in work, in friends, in families. And depression is not just a mood that happens when we are tired and we don't have energy. It's actually a medical illness. And this medical illness is mental illness or mental disorder, but also includes physical symptoms. And when we speak about depression as a medical disorder, we need to reach some criterions. Like there are symptoms that shows that if they last at least 2 weeks, then we can speak about depression in a way of medical disorder. So some of the symptoms of depression are feeling sad, irritable, anxious, loss of pleasure in activities that we used to enjoy. Sometimes we have feeling of emptiness. Maybe we don't have that much feeling of sadness as much as we have feeling of emptiness, hopelessness, guilt. Also, our energy becomes decreased. We have difficulty to do regular activities as dressing, taking care of ourselves, eating. There are changes in our nutrition and appetite. Of course, it depends from personal characteristics, but you can eat more than you used to eat, or you don't have any appetite. And also you have you can have some somatic symptoms, and somatic symptoms are those symptoms that shows up on your body, and they are caused by your inter-emotional state. For example, you can have pains, headaches, cramps, digestive problems, and what are depression. All those symptoms can be useful to be diagnosed, but every person is specific, and it has their own characteristics. Like sometimes we can see person from outside as she or he is pretty involved and engaged in daily activities, but it has to be some small part of their life where we can see that they start to withdraw themselves. And as I said, depression is something that can be diagnosed when you have symptoms at least 2 weeks. And psychotherapy, psychiatrist is a medical doctor who can give you diagnosis with depression. When we speak about patients who have chronic illness, especially MPS patients, it's pretty common that you don't get diagnosed with depression, because sometimes doctor thinks that depression is a normal reaction to your life situation. And sometimes they can say, oh, who wouldn't feel like that if he or she has a chronic condition? So I would really suggest you also, if you feel depressed, to find a psychiatrist who will give you certain tests so that you can get confirmation if you have depression or not. But depression and depressive mood is not something that it's supposed to be common for people who suffer from medical condition. And depression shows up as the most common complication of chronic illness. It's estimated that up to 1/3 of people with a serious medical condition have symptoms of depression. And the risk of depression going higher if you have progression of your disease, or if prognosis is poorer. So even when doctors recognize symptoms of depression, they may believe that anyone would be depressed in such a situation. So it seems that underdiagnosis of depression is more common, and it's a bigger problem than overdiagnosed. So what I would like to really support you is to find a medical professional who will be open to hear your symptoms, and then you will be able to get appropriate treatment. And when we speak in terms of depression and depressive mood, there are differences between depression as a mental disorder and grief as a normal part of accepting some loss. Because when you are a person with certain medical condition, with MPS, you have a progression of disease, and you have loss of some physical functions. And maybe at some point of your life you were able to walk, and then in the other moment you need to use wheelchairs. And when we speak about this, it's a loss of ability to walk, let's say. And that's why we can have, and usually we have grieving process, because we lost ability. And feeling of sadness, of emptiness, of anger, those are all normal feelings because you lost something that was important to you. And in those cases, we don't speak about depression. It's a normal process in human life and human development when we lose something that we find it important. And I think it's really necessary to be aware that not all feelings of sadness, emptiness, despair are depression. Like when we speak about those feelings, it's really important to take wider perspective, because if we are just focused on emotions, it's easy for us to put ourselves in category that we are depressed. But if this example that I used, losing ability to walk, if we put it in some wider context, then we can realize that those feelings of being angry, being hopeless, or being sad are normal part of reaction to that situation. But when we speak about depression, we have those feelings that last for a long period of time, and that it's really hard for a person to stay active in daily activities. And when we speak about depression, there are a couple categories, but I will use the simplest one. And in this category, we have mild depression, intermediate, and severe depression. And this classification shows just the level of depression. But no matter in which category you are, your own feelings are the most important. So when we speak about mild depression, it's a depression that affects our life, but we are still functioning. And usually in those situations, psychotherapy is something that is enough to get better or to find a way to cope with that. But when we speak about severe depression, it's a depression where risk of suicide is pretty high, and we need to have both pharmaceutical and psychotherapy treatment for patients with severe depression. There are phases in depression. There are acute phase where it's important to put symptoms under control, and the aim of the treatment in this acute phase is to get people back to living a full life and to stop symptoms coming back again. When we speak in terms of psychotherapy, as I said, depression is creative adaptation. It's creation that our body and brain create in order to protect us. Because in those moments, for us, it's too hard, too difficult, too overwhelming to confront with specific situation or trauma. And that's why we have depression as a creation, because it's paradoxically, it's easier to deal with that depression, and that depression covers the real trauma, let's say, that we are not ready to confront in that moment. What is important is to know that depression is it happens on a contact boundary. What that means? Contact boundary is a space between me and the other person. And when we have depression, that usually means that we don't have enough support from other people to show ourselves in the way we are. And that's why we create depression that will isolate us. For example, if I have another person across of me, and if I'm depressed, there are huge hole between two of us. We cannot connect. I feel alone, that person across of me feel helpless. And depression, in the same time, tell us that we cannot reach other person, but in the same time, it tell us that we need that. So that's why I think that depression shows up in that space between two people, because we had that experience that we didn't have enough support from people who are close to us, who are important to us. And we needed to create something that will be less painful. Because when we try to reach someone and we got rejected, a lot of times we need to find a way to protect ourselves. So depression protects us from reaching other people and get rejected again. And that's why I think that in treatment of depression, the most important is to create relationship. To create relationship, especially with your psychotherapist, that can give you another experience of being seen, being understandable, and being accepted. And I'm sure that or you had some experience of depression, or you were someone who was trying to help person who is depressed. And there are some pretty common things what we do when we want to approach person with who feels depression. We usually try to push that person to start walking, start moving, start living. We try to energize that person. When we don't get reply, we start to be angry because we are thinking, oh, why she just don't go out with me, or why she doesn't move a bit, she would feel better. We start to be angry, and we cannot handle that level of frustration, and that's why we isolate ourselves. So from the both sides, we have feeling of hopeless, and we have isolation. So if you are someone who have important person in your environment who is dealing with depression, the only thing that you can do is to be present. To be present in that feeling of nothingness. Because if you try to push that person, it will make just even worse. And after some while, you will feel tired, and you will decide that you cannot handle that level of emptiness and sadness, and you will quit contact with another person. When we speak about treatment of depression, what is the most recommended are combination of psychotherapy and antidepressants. When you use drugs, it helps your body and your hormones to get some balance. But the drugs are not something that will cure you. Like, psychotherapy is necessary to change your patterns, to learn you cope better with stress, or to help you reach some traumas that were covered with depression. So both parts are necessary when you're dealing with depression. Of course, depends from a level of depression, but if we speak about severe depression, it is necessary to both use psychotherapy and antidepressants. And there are a lot of people who are afraid to use antidepressants, and a lot of people who start use drugs, but after some while they say, oh, it's not working. So what would be my suggestion is that you really follow advices of your psychiatrist, because for antidepressants there need 4 weeks approximately to get some effects, and maybe your psychiatrist will not find you perfect drugs from the first time, but changing therapy also can be useful, and it also can bring some improvement. And when we speak about antidepressants, sometimes people taking them and they feel better, and then they stop taking medication, and then depression returns. So it's really important to listen your doctor, and usually after 6 to 12 months, therapy can be safely removed from your life. And what I would like to mention more is that psychotherapy is something that can make you feel better, because depression is treatable and it represents specific mechanisms in certain situations. So that's why therapy can teach you how to deal better with stress, with your mechanisms, but also it can give you experience for the first time for you to feel seen or to feel accepted, which depression usually doesn't give us. Depression isolates us, and according to me and according to a lot of scientists, relationship is something that can make a difference. Relationship in which you will feel secure and safe. Also, what can help you feel better is that you have realistic goals for yourself. There are some days where we have difficulties just to get out from our bed. And in those days, we don't have to put goals like to clean all house or to go out with friends. We can make some small steps that will just help us to feel better. Also, spending time with other people and feeling that you are not alone can make difference. Because as I said, the main goal of depression is to isolate us so that we can stay alone, and so that we can blame ourselves, so that we can tell ourselves that we are not good enough. But actually a relationship with family, friends, partner, therapists can give us a small hope that one day can be different. Also, every change or every step is highly important. We cannot expect that our mood improve immediately, but gradually, step by step, we can see that flowers get colors, that we laugh again, and that we find some purpose in our lives. And what can be also important is that in depression, it's not the best time for getting some important decisions, like to get married or divorce or changing job, because those decisions can be more objective if we share them with other person, or if we feel more confident to get some choices. And also education about depression can be also useful, because you will have some knowledge that depression is treatable, or you can find someone's articles and stories who were facing with depression, and see how they progressed and how they now they have content and satisfied life. And from my personal experience, when you're depressed, it's really hard to find any light. It's just a hole where everything is dark, where everything is without sense. But in the same time, when you have presence of another person, you can find some really small hope, but still hope that in the future can be different. And that's why I always suggest psychotherapy, because you will have therapists across of you who will not make your condition even more harder, but it will put in some context that is realistic, and some context with hope. And I really believe that with another person, with contacts, with medications and psychotherapy, we can make a change. And when we speak about MPS and depression, depression can be really adaptation to limitation that MPS creates. So it's important to work on both sides, like to take care of your physical health, but also to take care of your mental health. And that's it. Thank you.